Hi friends, are you coughing? Could you have pneumonia? Everyone will face this question one day, so in this video, we will go over why pneumonia occurs and touch on which pneumonias are contagious, what pneumonia feels like, how pneumonia is diagnosed and treated, and what you can do to prevent the next episode and to improve your recovery time. Pneumonia, or pneumonitis, can be caused by many different infectious agents. The root word pneumo means relating to the lung. When you have pneumonia, the lung is in an abnormal state. And no matter your age, you are at risk of pneumonia. We all are. All germs can potentially cause pneumonia, including bacteria, fungi, viruses, and even parasites. In case you're not aware, respiratory contagions are transmitted primarily by the air, and the closer you are to the source, the higher the load of that respiratory contagion. In enclosed rooms, the concentration of germs will be much higher. But of course, direct contact like rubbing your eyes, picking your nose, and licking your fingers, or not washing your hands before you eat can all contribute to picking up contagious critters. Habitual face touching is another way to get sick. My mom had a bad habit of doing that and would always touch her nose and her face. Now, medical students do this all the time, and I had to train myself out of it by sticking my hands in my pocket or just holding my hands together as I stood there listening to the attending. If you have bacterial pneumonia, you are contagious for 48 hours after starting antibiotics if your fever has gone away. Now, if you have persistent fevers, then you may be contagious for longer. Now, if you have tuberculosis, you may be contagious for weeks or months, regardless of having or not having fevers. If you have viral pneumonia, you're generally contagious until your symptoms start to reside, especially if you have fever, and that can be roughly about 10 days. Now, certain infections can be airborne, meaning you can be over 10 feet across the room from that infected person and still get exposed. Having good ventilation in the room is very important. This can be achieved by opening all the windows and creating a current with a fan, aiming the wind outside. You can also have HEPA filters to filter the air. You can turn on the exhaust fans in your bathroom and your kitchen. But the best way to increase ventilation is to meet people outdoors. Now, it's only considerate and safer for people around you if you're sick for you to wear a surgical mask to cover up both your nose and your mouth, especially if you're coughing. Now, if you don't have a mask, pull your shirt up to cover your cough or sneeze. It's much more effective than your hand or elbow. Some pneumonia, like Legionella pneumophilia, are really not spread from people to people, but in aerosolized water. That's why I don't like walking next to those misters at amusement parks. Fungal pneumonia is also not contagious, but you can get it from animals, like histoplasmosis is from bird and bat poop. Fungal infections are typically outdoor and airborne from inhaling aerosolized spores and can happen to anyone, especially during windy times or if there's construction or if you're disturbing plants like farm workers or gardeners. That's why all these workers really should be wearing N95. This can help prevent infections like valley fever, which is an infection from coccidioidiomycosis that lives in the dirt and travels in the air, especially in the Southwest. Now, the other day, I received a phone call from my friend who had this tiny nodule in the breast, which was then biopsied and turned out to be coccidioidiomycosis. So you may get infected from the air, but these infections can leave the lungs and invade other tissues. If you have plants inside your home or fresh produce like me, then that can be a source of Aspergillus, another fungus, or really it's a mold. That's that grayish black mold on your bread. Now, most of us don't have to worry about invasive fungal diseases and molds unless you have an immunocompromised state. And those are people who get diabetes or can have a chronic infection like HIV, or they are elderly folks or people going through cancer. If you meet any of these criteria, you should really consider putting your fresh produce in the refrigerator, eliminating your plants. And it really depends on your state of immunosuppression, but HEPA filters are really helpful for everyone. Check with your doctor to find out what you should do. How many of you are mouth breathers? If you are a mouth breather, you increase your chances of getting respiratory infections because a mouth is not designed to trap germs in the air when you breathe. The pipe that brings air to your lungs is called the trachea, and it's made out of a soft bone called cartilage. The trachea actually starts at the top of your neck. There is no screen door to filter the air. Whatever is in your mouth, including the air and food particles and the germs that live in your mouth, can go straight down. You can actually get pneumonia from your own germs that live in your mouth, your nose, and your sinuses. And when you aspirate tiny things, it's called microaspiration. And when you aspirate big things, you're actually choking. Everyone microaspirates all the time, especially in our sleep. Have you ever found yourself drooling and then you wake up from choking on your drool? I've done that. If you aspirate a couple of water droplets, that's no big deal. But if you are aspirating saliva filled with germs, and then there's some food particles in that saliva, that's a start of aspiration pneumonia, which is a major cause of community-acquired pneumonia. And this is why it is beneficial to always rinse and spit after you eat, so you don't inhale food particles that are trapped in between your teeth or your gums or under your tongue. And this is why it's a good idea to rinse, spit, and brush your teeth to reduce the amount of germs in your mouth throughout the day. However, don't use that mouthwash. That is not the way to go. There is a fine line between killing everything in your mouth and keeping the helpful, beneficial bacteria that actually helps you digest food. And when you use mouthwash, especially those alcohol-based mouthwashes, you will not only irritate your own cells, but you will wipe out beneficial microbes that help you digest your food to make helpful byproducts like nitric oxide. Have you ever taken antibiotics and noticed your tongue with a white coat? That's called thrush, and that's the overgrowth of yeast because the antibiotics killed off your good mouth bacteria. Now, when you have thrush, you are at higher risk of getting pneumonia. It's easy to check for thrush. Stick out your tongue and look in the mirror. If you have plaques on the top of your tongue, they're usually white plaques. They can also be on the sides or on the bottom of your tongue, and it usually won't scrape off. You know, if it's food, you put your finger on it, it'll scrape off. That is thrush if it's stuck on. And sometimes these white patches will be on the roof of your mouth, on your cheeks, or even inside your lips. Now, if you see any thrush, you should see a medical doctor. Now, someone with my skill set, an infectious disease doctor, can easily tell if it's thrush and can help figure out why you have it. Your mouth is also not designed to capture dirt or germs in the air because that's the job of your nose. And when you breathe through your mouth, there is no screen that will filter the dust mites, and that's why mouth breathing is an independent risk factor for developing asthma and increases asthma mortality. Children who snore have a higher rate of ear infections, eczema, nose and sinus infections, and they use more antibiotics. Now, when you breathe through your mouth, you actually change the pH of your mouth and build more acid to cause dental erosions and caries. This can increase the risk of invasive bacteria that can cause abscesses in your lungs and a condition called cavitary pneumonia, basically pockets or holes in your lungs. This is why it is good to brush your teeth at least twice a day, with one of them before bedtime. And everyone should see a dentist at least once a year to make sure your teeth and gums are healthy. Now, if you snore, you may have obstructive sleep apnea, and it's important to get that diagnosed and treated. People with severe obstructive sleep apnea have an 87% higher chance of being hospitalized with pneumonia and 48% higher risk of hospitalization with any infection. Now, if you know you have obstructive sleep apnea and refuse to wear the CPAP machine, then maybe this fact will motivate you. If you wear your CPAP properly, you can reduce your chances of getting hospitalized. There are lots of different types of masks to try, and sometimes using it during the day can help you get used to the pressure and the noise. Just ask your pulmonologist for some helpful tips. Your nose, on the other hand, is a filter organ. There is a reason why you have nose hairs, nose boogers, and narrow passages. Your nose hair traps large particles like allergic dust and pollen so that they don't get into your lungs. Don't pluck your nose hairs, or you may get that area infected with painful nasal cellulitis. There are also tiny hairs called cilia that push mucus and microscopic debris away from your lungs. And then this collects and dries up to become a booger. Kids are fascinated with their boogers, and they like to pick their noses, and that's how they get nosebleeds, as the inside tissue is very fragile. Some people use diffusers with essential oils to help open up their nasal passages like peppermint and eucalyptus. Now, the water that you use should also be sterile, and you can simply do that by pre-boiling drinking water. They actually sell medical tape for people who want to train themselves to breathe through their nose. Now, don't put any tape or object around the face of your children, as that may get loose and be a choking hazard. Please talk with your pulmonologist or your internist to find out what you should do to best train yourself and your family to breathe through their nose. And there may also be a correctable reason. Remember how your trachea is made out of cartilage? So if you are overweight or have an enlarged thyroid, that mass, that weight can both compress your trachea and obstruct your airflow. Do you know someone elderly who uses straws? My pet peeve is straws. I can't stand them. The ejection force from the suction that is created is really hard for people to control, especially when they get sick. Boba teas are horrible and an absolute choking hazard for kids. Now, there is a door that flaps between your food pipe and your windpipe, taking turns to close it off, and that's the epiglottis. That goes from food to air, depending on what you're doing. And these pipes are right next to each other. The movement of the epiglottis is controlled by your muscle. So when a person is weak on the outside, that muscle is also weak, causing frequent aspiration events because the door won't shut off properly. Now, here are a few other tips to avoid aspirating. Number one, never talk when you're eating. It's bad manners, you will spit food on other people, and you'll choke because that epiglottis can't go back and forth so quickly. Number two, never cock your neck back to drink, like this. That opens your airways and promotes choking. Of course, don't lay down to drink. Or position your neck with a pillow so that it aims downward. This forces you to swallow to get the food down the right pipe. Using a spoon to eat or drink is also an important tool for people who are struggling to relearn how to swallow. Hard and dry food is also more difficult to swallow, whereas soft and moist textures are best. However, if you're really struggling, too many textures are very difficult to control, and that's why people need to eat pureed food like baby food. And liquids can be a problem too if it's too thin. And that's why water is a common liquid to aspirate, and we have thickeners to help with that. If you think someone is struggling with swallowing, go get a formal swallow evaluation. You can meet up with an occupational therapist to make sure, and they can teach you techniques. Now, people don't always cough immediately when they're aspirating, and some people may not cough at all. Sometimes the cough reflex is not sensitive or it's actually lost. And some people can have a delay in coughing for as long as 15 minutes after they eat or drink, but you will notice this pattern. Document it and make sure you let your doctor know. So what does pneumonia feel like? Since there are a lot of germs that can cause pneumonia, there can be lots of different symptoms. And it all depends on how aggressive the germ is and how stimulating that germ is to your immune system. So that depends upon if you have a very strong or weak or inflamed immune system. So when your immune system is stimulated, you can have coughing, fever, shortness of breath, chest pain, and be very tired. This is commonly seen in viral pneumonias. Headaches are also not uncommon. And some people may just have low energy, lose their appetite, and feel very tired. You don't have to have any cough. If you do cough, it can be both productive or it can be dry. Older people can present with just confusion and not have any cough or any of the other symptoms. Young children can present with just nausea and vomiting. If you think you may have pneumonia, you definitely should see a medical doctor right away. Don't wait until your lips and fingertips turn a shade of blue or have uncontrollable fevers. When one organ struggles in your body, usually another one will struggle. 30% of people with pneumonia will actually have heart failure or a heart attack. Even though your lungs are inside your body, they are really outside your body because they're exposed to the air that surrounds your skin. Unfortunately, irritated lungs, they talk to you through coughing, through mucus, and shortness of breath. And by the time you have pain, that inflammation has left your lungs and may be in the sac surrounding your lungs called the pleural tissue, a condition called pleurisy. Sometimes coughing induces pain in the ribs. Some people cough so much that they can fracture their ribs. But most often, the ribs and the muscles in between the ribs, called the intercostal muscles, they get a good workout from the coughing and they feel sore or painful. Now, in this day and age, everyone should have a pulse oximeter, which measures your heart rate and how much oxygen you're actually getting inside your body. That's called the oxygen saturation, and that should be ideally at 100 or close to 100. And we actually worry when the saturation goes below 95. And we really worry if it goes below 90, which may need a call to 911 or at a minimum, a call to your personal doctor. Of course, if you have lung disease, these parameters may change, and you should check with your pulmonologist to get that ideal number. It's really important to keep your lungs healthy, which is easier said than done, as the air you are inhaling are polluted, no matter where you live. And some of us breathe in more air pollution than others. Air pollution kills 6.7 million people prematurely every year, causing strokes, heart attacks, chronic obstructive pulmonary disease, and lung cancer. It also makes you more susceptible to pneumonias. If you are a homemaker or you simply like cooking, please turn on your cooking exhaust, turn on your fan, open your windows. Indoor smoke from cooking can have levels of fine particles 100 times more than acceptable levels. Have you ever lived near a forest fire? I remember one year, like around 2002, my car was covered with ash from the forest fires that were 70 miles away. The thing is, that ash can be captured by your nose hair, but the fine particles get through and get embedded in your lungs and are irritants that cause chronic inflammation that can lead to lung cancer. Whenever you cook, you are making mini forest fires inside your house. Barbecue grills, they're even worse because when you burn food, you're making polycyclic aromatic hydrocarbons that have been linked to birth defects. And that's why restaurant exhausts are so unhealthy and can increase a person's risk of cancer. Of course, I don't have to tell you how harmful cigarette smoking is. Vaping or inhaling smoke from burning anything, including marijuana or your favorite candle, is all toxic and bad for your lungs. Now, you can make less air pollution in your home, and you can do lots of other things that can strengthen your immune system and reduce your risk of respiratory infections. First of all, hydration. If you can't make mucus or have healthy cilia that line your respiratory tract to catch and push germs out, then that's a recipe for illness. Number 2 is sleep. Your body needs sleep in order to make things like antibodies, which are proteins that serve as bullets and blockers of germs. Number 3 is another antibody called IgA antibodies that is in your mucous membranes like your saliva, your eye, your respiratory tract, and these can all attach to germs so that they don't attach to your cells. If this works right, then you'll never get an invader and you won't need to activate your backup B cells to make those IgM and IgG antibodies. Now, another thing is healthy skin. Healthy skin can protect your body from germs. Now, if you cut yourself on your finger, germs can go through and cause inflammation. Well, your skin in your respiratory tract starts from your mouth. Have you ever bit your tongue? It's super painful and can take a long time to heal if you are micronutrient deficient. Now, I meet lots of people who have wounds in their mouth that become heart valve infections or pneumonias. Ulcer or simply an inflamed gum like gingivitis from bad dentition can all lead to more respiratory infections. That's why it's important to make sure you have enough micronutrients like vitamin A and vitamin C and riboflavin and zinc to help your wounds heal within 24 hours. That's how quickly your cells in your mouth should be turning over. And that's why I supplement my diet with these vitamins. Remember how rinsing and spitting is good to get food particles out? Well, gargling with green tea after being in public has been shown to reduce respiratory illnesses. And this is another reason why I drink green tea, and I also take a supplement with green tea. Now, if you find yourselves struggling with symptoms of respiratory irritation, you may want to consider holding oral iron supplements. Iron is commonly found in your routine multivitamin. And the reason is because sometimes certain bacteria, they actually grow better with iron. And this is why doctors may hold your oral iron, which is shown to have better infectious disease outcomes. We're not sure if IV iron replacement would have the same negative effect. Another thing that people aren't doing is getting more sunlight, especially early morning. Sunlight stimulates your body to make an important vitamin called vitamin D. That's important for your immunity. I strongly believe everyone needs to be in a vitamin D supplement, as data shows too many people are deficient, and when you're deficient deficient, you will weaken your immune system. Without vitamin D, you are at higher risk of all sorts of respiratory infections. The lower your vitamin D level, the greater your risk. Taking a daily low dose appears to be more beneficial than bolusing high doses, although some people may need both. The benefits of vitamin D supplementation is not just for respiratory infections. It's been shown to reduce the risk of acquiring an autoimmune disease. However, too much sunlight is actually immunosuppressive, and that's why sun tanning is dangerous, especially for children who can get dangerous skin cancers as adults. Now, there are other important supplements that help your metabolism work optimally. Have you ever heard of N-acetylcysteine? It is a supplement that supports your glutathione detoxification system that's involved in reducing your stress in the body, specifically for your cells. This stress is called reactive oxygen species and poisons your mitochondria that is responsible to keep you from growing too old too fast and from getting sick. Now, glutathione is always working 24/7 to reduce reactant oxygen species. I like to call it ROS. And this basically slows down aging. ROS damages your DNA. N-acetylcysteine is a precursor to glutathione that allows your body to keep regenerating glutathione to prevent oxidative damage from accumulating. ROS is rapidly being produced when you have respiratory infections, and N-acetylcysteine has been shown to reduce ROS and improve clinical outcomes. Physicians commonly use N-acetylcysteine as a nebulized solution to thin mucus, or we give it intravenously to protect the liver against toxins like acetaminophen. Now, this paper showed N-acetylcysteine actually reduced the frequency, duration, and severity of influenza infections. And this is why I take NAC daily. But the glutathione redox system also needs adequate magnesium, selenium, and riboflavin. And that's why I take a low dose of multiple supplements to top off my diet. If you want to know what I take, I have a link in the show notes below. I also love berries, and it seems like there should be a berry solution to respiratory struggles, right? And there actually is. Properly prepared elderberries have been clinically tested to reduce cold severity and symptoms. And if you want to learn more about elderberries, watch the next video.